We've been talking for years on the program about how to best get health care to everyone. And I'm using that phrasing as opposed to saying Medicare for all or nationalized health care or whatever else, because there are actually different ways of getting health care to everyone. And many different countries at our level of development have different systems, all of which relatively effectively achieve that goal. And this is something that's really important to be informed about because the right likes to give these out of context anecdotes and use general talking points to try to sort of meld all of the healthcare systems in different countries together and derail the conversation. I'll give you some examples and then you'll understand what I mean. We hear, oh, healthcare for all is bad because people wait forever for care in Canada. Or healthcare for all is bad because the UK's public hospitals are terrible, or whatever. And the point that I want to make to you today is that there is no one healthcare for all is bad talking point that works because these countries all have different systems. When in the United States, we say the rest of the developed world has figured this out, that's true, but in different ways. And we've mentioned before the difference between, for example, single payer systems and nationalized healthcare. Those are two different things. The whole point here is everybody has access to care, quality care, at a price that they can afford, sometimes the price being zero at the tail end, but paid for through taxation. But the systems are very, very different. Now, I am relatively agnostic as to how we get there. What I care about is what does the system cost in total, and is it affordable for the end users? What does it do in terms of access? And what is the quality of healthcare that is provided? And wait times would be part of what I would consider quality. So let's talk about some of the differences that are sort of out there. Canada and the UK both have single payer systems. But in Canada, as we've recently talked about because of a procedure Rand Paul is going to be undergoing in Canada, the providers are still overwhelmingly private, although they often receive money from provincial governments. The insurance is single payer in Canada at the province level, but the healthcare delivery system has not been socialized and taken over by the government. Canadians will often pay for additional coverage through jobs for prescriptions, dentistry, optometry. The government ends up spending about 70% of all healthcare expenditures. Then we look at a country like Britain. We look at the UK. Healthcare itself has been socialized or nationalized, you can say, meaning that the government is providing most of the care through the National Health Services. There is a private system in the UK. Only about 10% of people have it, but the government does about 80% of the healthcare spending. But again, the government is providing a lot of the care through hospitals and clinics that they run. We've talked before about the Singapore approach, which is very different. Actually did an interview about the Singapore healthcare system. In Singapore, there is cheap and sometimes free care made available in government-run hospitals. Workers contribute about 37% of their wages into mandated savings accounts. Those accounts aren't just used for healthcare. They can also be used for housing, for insurance, for investments, for education, and employers also contribute a piece to it. So it is a sort of taxation plus government-run model that is still more market-driven than some of the others. You have the opportunity to pay more for private rooms or more luxurious care if you can afford it or if that's important for you. Since so much runs through the government in Singapore, the government will negotiate drug prices. They will be involved in setting doctor salaries, etc. It's way cheaper than the United States. 4.9% of GDP versus 17% of GDP in the United States. It's also a much more efficient system, but it does have some shortcomings, which we can dig into a little bit later. Let's look at Australia. Australia has free inpatient care at public hospitals, and they also have a voluntary private insurance program. The government in Australia is paying about 85% of outpatient services. The rest is made up with this optional private insurance. If you look at France, in France, everybody is buying health insurance that is sold by nonprofits. They don't have it is a nonprofit healthcare industry. It's financed through taxes and it covers up to 80% of healthcare costs. Then it's up to you if you want to get insurance for that additional 20 or 30% that's not covered, or pay for it out of pocket. Then we look at a system like Switzerland. Switzerland has a universal healthcare system where everybody has to buy insurance from nonprofits. 30% of buyers get subsidies based on income. As a percentage of GDP, it's a little bit more expensive, but they have extraordinarily good health outcomes as well as access to care in Switzerland. So all of this is just to get us to today's conversation about Germany, because Germany's healthcare system is not discussed nearly as often as it probably should be. And over the weekend, there was an op-ed written in the New York Times about the healthcare system by Jamie Daw, who's a Columbia a public health or health policy professor. And the Professor Daw, says that the German system is better. Germany's system achieves universal coverage for most services. It costs less than Canada's. Obviously, it costs less than the American system, which is one of the worst, while simultaneously being one of the most expensive. And it is not a single payer system, importantly. It's a multi-payer system, and it has a really interesting history. And I've spoken about some of this before. The system Germany has right now goes back to Otto von Bismarck in 1883. And we actually spoke to former Cigna executive Wendell Potter on the program about this, and he talks about it in his book, Deadly Spin. The United States at one point, between World War I and World War II, was actually heading in the direction of this Otto von Bismarck German system. But the timing of it was such that the United States didn't want to seem to be doing the thing that Germans are doing, because Germany was a growing enemy of the United States. The system was abandoned. The idea for that system was abandoned in the United States, and we ended up with the system we have now, which is truly a disaster. The system Germany has, you have to have health insurance, okay? There are about 100 private nonprofits that are insurers that you can choose from. Workers and employers are sharing the costs through payroll taxes, similar to what a Medicare for All system might be in the United States. And the government finances coverage for kids and unemployed people. Now, important detail. Just because the cost is shared by employers and employees doesn't mean that the plans are tied to your employer or to having employment. And because the system is funded through progressive taxation, access is actually based on need, not one's ability to pay, or how much you contribute is based on your income rather than whether you're healthy or you're not healthy. And there's a sort of genius element to this, which is that all of the taxes for these programs are collected centrally, and then they're distributed to the nonprofit insurers on the basis of the health of the people that are members. So let me give you an example. If you're a nonprofit insurer and the people you are insuring tend to be more sick than another nonprofit insurer, you will get more of that money that is centrally collected and managed by the German government in this central fund. In total, they spend way less per person than in the United States and in many other countries that have other forms of universal health care. But importantly, they're not limiting access to care that people need, which is often a talking point we hear about some of these systems. The right loves to say care is rationed in a lot of these countries. Number one, care is also effectively rationed in the United States in other ways. And it's also just not true that in these systems you don't get the care that you need. You get the care you need. There may be less urgent procedures for which you might have to wait a little longer than you potentially would in the United States. But that doesn't mean people aren't getting the care that they need. And this gets us back to the Bernie Sanders proposal. This is actually very similar to what Bernie Sanders has proposed, which is using payroll taxes both on employees and employers. The difference is that in Germany, the money is going to nonprofit insurers instead of a single payer system. And not only in Germany, but also in Austria and the Netherlands, they have had serious reduction to the cost of care down to Medicare levels, which is considered to be something good to aspire to in terms of cost of care levels that we have here in the United States. The other really interesting element about the German healthcare system is that it gets everyone coverage. It doesn't stifle innovation. It still removes profit from health insurance, which I don't believe should be there as a social democrat. And it maintains choice, which is what a lot of people fear will be taken away under some government-run systems. So no system is perfect. They're basically all better than what we have. And it's really important to understand that the talking points that the right loves to use on this simply don't apply in general because every country has a different system. In terms of Bernie Sanders and Medicare for all, my suggestion would be we don't need to be overly attached to Medicare for all. Medicare for all has some issues. One is that people who have Medicare in the United States, 80% have additional coverage, according to a recent study. They're either having Medicare plus some kind of employer plan, Medicare plus Medigap insurance. Some people are poor enough that they have Medicare plus Medicaid, and there's a few other things in there. So once we understand that, let's remove the sort of emotion from the entire thing. Let's look at a system like Germany's at the same time that we consider Medicare for all type systems, a nationalized system like the UK has, a system that is more like Canada's. All paths forward should be considered. Once again, I am in general agnostic as long as there is a direct path to moving to another system, because every single developed country has a better functioning system at a lower cost than the one that we have. I want to hear from you about this. Are you preferential to the German system? Do you prefer the British system, the Canadian system? If you're particularly attached to Medicare for all, let me know why. I'm on Twitter at @DPakman, and the show is on Twitter at David Pakman Show.